Hi, my name is Haley Green, and I'm going to be the student clinician that's completing a comprehensive voice evaluation. Today I'm working with Robert Dane, but he goes by Rob. He is a 67-year-old male who's experiencing voice changes following a recent thyroid surgery. This assessment will include a case history, self assessment, perceptual, aerodynamic, and acoustic measures. And I'll explain each step as we go. Okay, Rob, if you have any questions or concerns, just stop and let me know. Ready?
Yes.
Good. All right. So, Rob, I'm going to start by asking you a few questions about your voice and your medical history. When did you first notice changes in your voice?
I had surgery on my thyroid a few months ago, and ever since, my voice has been giving me trouble. Can't seem to speak louder than this. And I just get so tired when speaking. I'm having issues being understood, especially on the phone.
Okay, I understand. I can see how that would be extremely frustrating. Looking at your chart, is your only medication still the vitamins?
Yes.
Okay. And have you had any changes to your allergy list?
No.
All
just
right.
seasonal allergies.
Oh, okay. And does the pollen affect your voice in any way that you know of? Like, does it really bother you?
No, it just makes me congested and sneezy a lot.
Okay. All right. And are you in any pain today?
No.
All right. And then what is your primary language?
English.
English. Alrighty. All right. Your chart says that your hearing and vision tests were both good and within normal limits, so that's great. Then how would you describe your voice now compared to before your surgery? Have you had any issues before your surgery?
No, it was completely normal.
Okay. All right. So you said that you get tired after speaking. Is it more so during conversations that you start to fatigue, or is it when you wake up, your voice is pretty strong, but by the end of the day, bedtime, you're pretty weak?
It's kind of both. It just depends on the situation.
Okay. Alrighty. So I understand. What kinds of situations do you use your voice the most in? Like phone calls, conversations, work?
Mainly for conversations.
Okay.
Social settings, I guess.
Mm-hmm.
My wife's pretty good at understanding me.
Mm-hmm.
So it's not as hard to talk to her.
Okay.
But when I go play golf with my buddies, I'm pretty tired after that. Ever since this issue started, I kind of avoid the phone because people can't hear me.
Okay.
So I either have my wife talk for me on the phone or I text.
Okay. All right. Well, it's a good thing your wife can understand you pretty well. You say that people can't hear you. Can you expand on that? Is it just on the phone, or is it when you're talking to people face to face?
I'd say it's mostly when I'm on the phone.
Okay. All right. Have you noticed any coughing or choking when you're eating or drinking?
Maybe sometimes when I'm drinking.
Okay.
But it's stuff going down the wrong pipe.
Okay. All right. So you don't think it has anything? You don't feel like your swallow or anything's messed up? It's just an occasional, just going down the wrong pipe.
No, not that I've noticed.
Okay. And it doesn't. Is it only with liquids? It's not with food?
Not that I notice.
Okay. All right. So how about coughing or clearing your throat throughout the day? Do you do that often?
Well, I guess I do clear my throat fairly often, but I haven't really thought about it.
Okay.
And I think I cough a normal amount.
All right. So nothing out of the normal. What about any reflux? Do you have any acid reflux or anything like that bothers you?
No, not really.
Mm-hmm.
I'll get it sometimes, but I take some Tums and I'm good.
So it's nothing unmanageable. All right, cool. And lastly, I want to talk to you about some of your vocal hygiene. Are you a smoker?
I was, but I quit about 15 years ago.
Oh, okay, cool. When you did smoke, how many a day did you have roughly?
Maybe 4 a day.
Okay.
Not sure. Just depends.
And what format was that? Was tobacco, cigarettes, or
cigarettes?
Okay. What about caffeine and water intake?
I have a couple cups of coffee in the morning.
Okay.
And an occasional soda
All right.
during the day. I try to drink a lot of water, but I could definitely do better.
Yeah. All right. And then what about alcohol? Do you drink alcohol?
No, not very often.
Okay.
A few times a year.
All right. Thank you so much. All right. So that was all of your medical history. So the reason I'm asking you most of these questions is because I want to understand what your perception of your problem is. Following your thyroid surgery, it's possible that there's some nerve irritation or damage or even weakness from your surgery that could be affecting your vocal cords. But we're going to figure that out and get you back on track, so don't worry. I asked about your coughing because I wanted some information about your airway protection while you're eating and drinking. And we're also going to look into that too. So the next thing we're going to do is an oral motor assessment. And I'm going to do this because I want to ensure that everything in your mouth is doing what it's supposed to be doing and that nothing's negatively impacting your voice.
Okay.
So, all right. So what I'm going to do, I'm going to put on my gloves. All right. And then I have a clean tongue depressor here with my light that I'm going to use to look in your mouth.
Okay.
So your face looking at you have good symmetry, so I don't see any obvious drooping or anything. Can you open and close your mouth? Good. All right, and then can I see your smile? Awesome. All right, what's your dental status? Do you have any?
I wear dentures.
You wear dentures? Okay. Write that down. Okay. You smiled, your smile was good. Can I have you pucker your lips out? Good. All right. Now, can I have you puff out your cheeks? Good. Awesome. Now, I'm going to look at your tongue. Lift it up so I can see your little tongue tie. Good. That looks great. Now, I want you to stick out your tongue and move it side to side. Good. All right. Now, go up and down. Good. Alrighty. Now, I want you to go, so you're going to make the sound ah, and you're going ah, 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 and I'm going to look at your palate to see how it moves.
Ah, 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 ah.
Good. All right, now you're going to do the same thing, but I want you to do the sound putica, putica, putica.
Putica?
Mm-hmm.
All right. Putica, putica, putica.
Great. So what I was doing with that, I was just making sure your tongue was going where it's supposed to be going, and it did. So that's all good. I don't see any weakness, so I think your oral motor is doing well. So next I'm going to have you complete a questionnaire that is right here, and it's the Voice Handicap Index.
Okay.
This is going to help me understand how your voice affects you physically, emotionally, functionally in your daily life. And I'm choosing this assessment because it's appropriate for adults with voice disorders, and it will help me quantify how much a voice problem can impact your communication.
Okay.
All right, awesome. Thank you so much. Yep, that's for me to do. Great. All right. So the next thing I'm going to have you do is something called the CAPE V. It is it's an auditory perceptual assessment that stands for Consensus Auditory Perceptual Evaluation of Voice. That just means I'm going to evaluate your voice with categories like roughness, pitch, loudness, strain, things like that. It will allow me to rate your severity across structured and natural speech in a standardized way. So the first thing I'm going to have you do is I want you to sustain a vowel. So you're going to make the sound ah, and you're just going to hold that for about 5 seconds.
Okay.
Whenever you're ready.
Ah.
Good. Awesome. All right. Now I want you to do the same thing, but with E.
E.
Mm-hmm.
E.
Great. Awesome. All right. Now I want you to just repeat these sentences after me. The blue spot is on the key again.
The blue spot is on the key again.
Good. How hard did he hit him?
How hard did he hit him?
We were away a year ago.
We were away a year ago.
Good. We eat eggs every Easter.
We eat eggs every Easter.
Awesome. My mama makes lemon muffins.
My mama makes lemon muffins.
Yeah. And last one, Peter will keep at the peak.
Peter will keep at the peak.
Awesome. All right, and then this last one is going to be a spontaneous speech. So I just want you to tell me about your voice problem, even though you've already told me. I just want to hear you talk for about 20 seconds.
Okay, so it seems my voice seems to be weaker near the end of the day.
Mm-hmm.
When I get up in the morning, it's okay. But as the day goes on, it seems like it just keeps going down and down.
Mm-hmm.
So it makes me feel kind of uncomfortable in social situations.
Okay.
When I'm out with my friends or even at work.
Okay, that was perfect. Thank you so much. Alrighty. So, we've done that one. So, you did awesome. Next thing we're going to do is something called an SZ ratio. This is an evaluation tool that will assess your vocal cord functioning. It's going to look at your breathing and your respiratory functioning and your vocal fold closure. I'm going to have you make the sound S and have you hold it for as long as you can while I time you. Then you'll do the same with Z sound. You're going to do this twice. So let me get my timer. And then whenever you're ready, just remember you're going to start with S and just hold it for as long as you can.
So like the S sound?
Mm-hmm.
Okay. Ready?
Mm-hmm.
All right.
All right. All right. Now go to Z.
Z.
So Z, and hold that one for as long as you can. Good. So you're going to go back to the S sound and do that one as long as you can, whenever you're ready. Good. All right, and then the Z sound one more time. Good. Awesome. Good job. All right, we're getting through it. Next thing we're going to do is, all right, that was great. So the next thing we're going to do is an assessment called the MPT, which is the maximum phonatory time. So this test will again look at your vocal fold functioning and how long you can hold your vocal folds open. It's pretty much the same process as the last assessment, just with different sounds. And then this time you're going to hold ah for as long as you can while I time you. So whenever you're ready. Good. All right. Good job. So while I'm doing this assessment, I'm also observing your breathing patterns, your posture, and your overall muscle tension. Okay. Next thing we're going to do is an acoustic assessment. I'm going to do this via Pratt, which is a acoustic software. Acoustic measures provide data to support what I can hear perceptually, like what we just did, and it will give me a baseline information to track your progress over time. So I'm going to record you doing some tasks. So you're going to glide up from your normal pitch, go up as high as you can, and you're going to do the same thing, normal pitch, going down as far as you can. We're going to do a loud hey and then a quiet hey without a whisper, and I'll explain it more once we get to it. You're going to count to 10, and then we're going to do a conversational sample. I know this is a lot, so you're doing really good. All right. So, This first one will be 10 seconds. It'll be counting to 10. So whenever I'm going to press record, and then you're going to count to 10.
Okay. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Awesome. Good. So that has been saved. Yes. So now we're going to do another one, and this will be your conversational sample. And this, I just want you to talk about whatever you want to talk about for about 10 seconds.
So it doesn't matter.
No. I'm just recording your pitch.
Okay, so I got up yesterday morning and went and played a round of golf with my friends. I did okay. Wish I could have played better than what I did, but sometimes you play good and sometimes you don't.
Good. All right, that was perfect. Awesome. Really good job. So now you're going to do a loud hey. This is going to be where you're not yelling, but you're going to, as loud as you can go without, hey, I'm yelling. You know what I'm saying?
Okay.
So, hey. Like that kind of hey.
Okay.
And I'm going to press record, and then you're going to do, after that, you're going to do a quiet hey, which is going to be as quiet as you can go without a whisper.
Okay.
So this will be loud hey.
Okay. Hey!
All right. Very good. Now we're going to do quiet hey. All right.
Okay. Hey.
Very good. All righty. Now we're almost at the end, we're going to do a glide up. So go at your normal speaking tone, and you're going to go up in pitch. Okay?
Okay, I'll try.
All right, just do your best. You're doing great. So, glide up.
Hey.
Awesome. That was really good. Now we're going to do a glide low.
Hey.
Awesome. Really good. You did great. That one's all done. So I'm going to analyze that later, and I'm going to figure out your fundamental frequency, your loudness, and your pitch range, which should give us some more answers as to what's going on with your voice.
Okay.
So I'm not going to perform any imaging today, but you would probably benefit from some, particularly a stroboscopy to evaluate your vocal cord functioning, as well as a FEES to get a closer look at your swallowing, like to see how that coughing with your liquids is going, and what could be going on there. But other than that, we are all done, and you did great. So next time I see you, I will hopefully have some answers about what's been going on and have some recommendations about how we should move forward. Do you have any questions?
No.
No?
That's good.
All right.